Hi, I'm Diane Rizzardo, and I'm an ortho, sport, and pelvic physio practicing out of the Lower Mainland in BC. Like you, I'm also a half marathon, marathon, and ultra marathon runner. And I often get asked if running is good or bad for your pelvic floor. And the answer is that it's neither good or bad. In some cases, running can help strengthen your pelvic floor, and in other situations, it can weaken it. So the first step is to understand what your pelvic floor is. Your pelvic floor is a group of muscles and ligaments that form a kind of a basket, and they stretch from your pubic bone in the front all the way to your tailbone in the back and from one sit bone to the other. This group of muscles is involved in core stability. It helps control urinary and bowel functions, sexual function, reproductive functions, and supports the internal organs against gravity and downward abdominal pressure. So when the pelvic floor is acting effectively, it should act kind of like a trampoline and be able to absorb shock. It's kind of like a jellyfish. It needs to be able to contract and relax to work properly. So it's really important that your pelvic floor is able to contract and relax while you're running. So you might ask, why does pelvic health matter for runners? So running particularly long distances, like you will be doing with the TCS Toronto Waterfront Marathon and Half Marathon, places a significant amount of stress on your pelvic floor. You can sometimes get symptoms that we're going to talk about in a second, and these symptoms can happen to anybody of any age. So it doesn't matter what age you are, and it doesn't matter if you've had children or not. So we see people in our clinic for all ages with running-related pelvic floor issues. So symptoms that your pelvic floor might not be functioning optimally include urinary incontinence or leaking, pelvic heaviness or increased prolapse symptoms, pelvic pain, and you can also feel sometimes lower back pain that's not resolved with normal physio, pubic symphysis pain, and SI joint pain as well. So there's some tips that we have to help you maintain good pelvic floor health while running. The first one is to release tension while running. It's really important to understand that not everyone needs to do Kegel exercises. For some people, especially those with an overactive or tight pelvic floor, doing Kegels can actually make your issues worse or create issues. The same goes for your core. We don't want you to be holding your core tight the whole time that you're running. Holding your core and pelvic floor tight while you're running can increase the intra-abdominal pressure and increase the downward pressure put on your pelvic floor, which then stresses your pelvic floor out more. So when you're running, try to breathe deeply into your belly and really let your belly go. You can also try relaxing your jaw. So there's a big connection between your jaw and your pelvic floor. So if you're someone who grinds your teeth at night or during the day, or you have TMJ pain kind of in here, trying to relax your jaw, trying to maybe put your tongue on the roof of your mouth, try to help let those muscles relax, can have a really positive effect on your pelvic floor. The second thing we're going to talk about is optimizing your running technique. So for this, we really encourage you to think of tits over toes. This means that when you're running, you want to slightly lean forward to decrease the pressure put on your pelvic floor. You want to think of your ribs stacked right over top of your hips, and then you want your whole body to lean slightly forward. You can think of this when you start running. So as you're just about to start, kind of let yourself fall forward and fall into a run, and that will help give you that tits over toes lean. Another thing you can think about with techniques is to slightly shorten your stride and slightly increase your cadence and your turnover. This decreases the amount of ground reaction force, which is the force from the ground up into your body and into your pelvic floor, which again can decrease the overall stress put on your pelvic floor when running. The third thing we're going to talk about is incorporating core and pelvic floor friendly exercises into your cross training. In your cross training, we really want to include exercises that target the deep core muscles. These exercises will help provide a lift to your pelvic floor. And you also want to incorporate trunk and hip thoracic and hip mobility to help also decrease that pressure on your pelvic floor and let that system work optimally. You can refer to the strength and mobility workout attached to this week's program for some examples of exercises that you can try to incorporate it into your routine. The next thing we're going to talk about goes hand in hand with this, and this is single leg exercises. When you're running, you spend most of your time on one leg. So working on single leg exercises in cross training can really help create strength, stability, and symmetry throughout your pelvis, hips, and pelvic floor. Some of your pelvic floor muscles are actually deep hip rotators. So working on those deep hip stabilizers can create a strong foundation, which will not only improve your pelvic floor function, but also help you run stronger and with more ease at the TCS Toronto Waterfront Marathon. We're going to move over and talk about hydration a little bit. So we really encourage you to stay hydrated, maybe work with your nutritionist to make sure that you're getting enough hydration and electrolytes in. But we want to also talk about the fact that drinking too much before your race, right before your race, can increase the likelihood of urinary incontinence. So this is something to practice while you're training. You want to drink little sips of water on the course, maybe plan 1 or 2 bathroom breaks so that your bladder doesn't get too full, and try going to the bathroom before you start your run. Especially on a race day, sometimes our pelvic floor muscles can get a little bit tight just because of the anxiety and nerves of a race, and you might feel like you maybe don't fully empty when you go to the bathroom before a race day. What I suggest, find somewhere that has a toilet, or if you're in a porta potty, which you often are, lie in the seat, actually sit down. So you don't want to be hovering, sit down, take a few deep breaths, maybe relax your jaw and take a few deep breaths, try to go pee before you get up and leave the porta potty, take a few more deep breaths, maybe shift around and then see if anything else comes out, because sometimes your pelvic floor, when you're anxious and nervous, gets tight and holds on to pee. So even because you went to the bathroom before the race, maybe you didn't get everything out and you still feel like you have to take lots of bathroom breaks during the race. So this is a good tip just to try to relax the pelvic floor. You can practice this leading up to race day, but for sure the morning of race day, that last pee before you hit the roads, you really want to try and let as much pee go out as possible. And it's not a push to let the pee go out, it's really a relaxation. Next thing we're going to talk about is our last thing, and it's going to be breathing. So your diaphragm and pelvic floor work together. So this is your diaphragm. It's a flat muscle that lives underneath your rib cage, and this is your pelvic floor. When you breathe in, we want them both to drop and lengthen, and when you breathe out, we want them both to lift. So what happens here is it manages the intra-abdominal pressure in your belly and decreases the amount of pressure put on your pelvic floor. So we want to breathe into your belly and breathe into your back. So if you notice that when you're running, you're really tensing up through the shoulders and maybe you're breathing up into the shoulders, can you relax the shoulders? Try to breathe a little bit deeper into your back and a little bit deeper into your belly. And that overall, over time, is going to put less pressure on your pelvic floor. So to wrap it up, your pelvic floor is just as important as any other muscle group when it comes to running. By assessing your pelvic floor needs, incorporating appropriate exercises into your routine, optimizing your running technique, and listening to your body, you can enjoy a healthier and more comfortable running experience. If you're experiencing symptoms like urinary incontinence, pelvic pain, or feeling heaviness anywhere in your pelvic region, or a side joint pain or pubic symphysis pain, really, we encourage you to seek help from a professional pelvic health physiotherapist as quickly as possible. Early intervention can make a significant difference. Remember that a strong pelvic floor is not just going to increase your running performance, but help your overall well-being. Have a great time at the race, and we hope to see you again next year.